Hey everybody, I'm Nina Crowley, Seeker's Professional Affiliations and Education Manager, and I'm excited to be here today with Dr. Audrey Wells. She is the founder of Super Sleep ND, which is an online platform for people who struggle with sleep apnea. And I'm going to let you introduce yourself because you've got so many interesting qualifications. And we interacted about obesity and sleep, and I just found the conversation so interesting that I wanted to share it with everybody else. So thank you.
Oh, that's awesome. I'm glad to hear that. So I am triple boarded in sleep medicine, obesity medicine, and pediatrics. And believe it or not, they all interplay when you are underslept. I like to say that my adult patients look like toddlers when they're sleep deprived. And so I have just the right expertise for them. But yeah, I started Super Sleep MD maybe a year and a half ago because I was really frustrated with not being able to provide the education and support through the medical delivery system. So it's an online platform to support people who struggle with sleep apnea.
Love that. And I think this is such an area, my background is in bariatric surgery for 17 years. And so this was always a conversation that we had with patients, leading up to surgery. Often one of the reasons people pursue surgery, one of the health comorbidities that they're hoping to get rid of. But I think something you and I started talking about is this idea that like with a lot of things in bias, it's either, people relate it all to their weight or they don't consider it at all. And I think, even with surgery, it was kind of like you're going to have surgery and then you're not going to have sleep apnea anymore. And I know that's not the case. So I thought maybe you could educate us a little bit more on that kind of a concept.
Yeah, I'm really happy to talk about it because it's one of the bigger misconceptions about sleep apnea. And I think it contributes to internalized bias for people who have obesity. So the idea is that if you have sleep apnea, it's because you're overweight or have obesity. And if you lost weight, then your sleep apnea would go away. So there's a little bit of a bi-directional effect there. And, what I can say is that sure, weight gain and obesity is the number one risk factor for obstructive sleep apnea. And it's nice because it's a modifiable risk factor, so it has that going for it. However, weight loss does not always mean that you would get rid of your sleep apnea. And unfortunately, a lot of people who undergo a bariatric surgery or have significant weight loss through behavioral means or pharmacotherapy tend to not get rechecked like they really should. They sort of rely on the absence of snoring to say, oh, my sleep apnea has gone away. And the truth is, snoring is not a great marker for the presence or absence of sleep apnea.
That makes a lot of sense. But yeah, that bias of this is just going to go away. And then probably the even more, if someone doesn't have that go away after they've lost weight, that's even more, frustrating and confusing.
It certainly can be. And the problem is, if you rely on the absence of snoring to say, well, I've lost weight, I don't have snoring, therefore I can't have sleep apnea. If that's not actually true, if you do have some residual sleep apnea, which causes drops in blood oxygen level and awakenings or arousals from sleep, then that could actually sabotage your weight maintenance. You could gain weight back because sleep deprivation is a stimulus for weight regain.
That's a complicated pathway, but important. And I feel like we don't talk enough about sleep. Even in my program, it was very much, we talked about weight, we talked about changes to the body after surgery, and we had dietitians in there. We had less of a consistent behavioral health presence, even less of a presence with exercise specialists, but really no follow-up to in a consistent way with our sleep specialists. So gosh, and as you said, all we do is eat, sleep, and move, right? So
Right.
how do you see that working in, better pathways or programs or how do we do that better?
I'm right there with you. I think in medical school, I may have gotten an hour or two of sleep education. I did not even know it was its own specialty until I was doing a pulmonary and critical care fellowship. And then it was like, wow, I really resonate with that message that sleep is a fundamental biological need and everybody does it. And for anybody who's watching, just think back to the last terrible night of sleep that you had, or maybe your sleep was restricted because you were trying to complete a project or you had, some sort of obligation for travel or work. And when you start pinching down your sleep time and when you're sleep deprived, you suffer. Your brain can't think as well. You don't have as many problem solving capabilities. Your emotions tend to be dysregulated and definitely more toward the negative. And you become sort of this hedonic reward seeking machine. And a lot of times that includes eating foods that aren't on a healthy diet plan. It means that you sacrifice time to exercise or move your body, whether that's cardio or lifting weights or whatever. And you may have some other behaviors like forgetting to take your medication or, doing something risky or impulsive on the highway or at work. Sleep deprivation affects everybody acutely. So just thinking about, if you're chronically sleep deprived and trying to engage in a long-term endeavor to lose weight, for example, that's going to be handicapped by the effects of sleep deprivation. So it's really important to get your sleep.
Wow, I think any one of those that you mentioned, even a tiny shift in any one of those can have such an impact on your weight and your health and how you're feeling. So as they kind of pile on and add up, gosh, that's a big deal.
And we tend not to prioritize sleep in our society, right? I mean, it's kind of a 24-hour world, and everybody's trying to accomplish so much. Sleep is often the thing that gets pinched, either going to bed later or waking up earlier. So there's sort of a cultural aspect to it, too. So until it's prioritized, I don't think that you can actually become the best version of yourself until you are well slept.
Well, that seems like, I mean, one of the messaging, we talked a little bit about messaging for, nutrition and exercise. Often that gets really oversimplified. We don't like that, eat less, exercise more, which can be stigmatizing and just, too simple to actually be helpful, right? But I definitely have heard that in the sleep realm, right? Of just, well, just
Yeah.
get your sleep and just get 8 hours. And, everybody's kind of got that down to a simple message, but really we know in behavior change that for complex health behaviors like sleep and eating and moving, just do that is not ever really good enough. And so how do we teach our folks to do better with messaging around that too?
That's a really great question. And I think until this is sort of at the top of what we want to discuss, there's always going to be some trouble in connecting the dots. If I were to give sort of a short form answer, I would say that, prioritizing your sleep is key. And even from the moment we wake up, we're kind of deciding how we're going to sleep the next night because factors like stress, exercise, light exposure, meal timing and meal content, socialization. There's a lot of things that sort of help or hurt our ability to get healthy sleep. One of the concepts I like to describe is the idea of having contrast and balance, which means that during the day, you want a lot of light exposure, for example, whereas at night, that's going to go away. And light is one of the most important signals for healthy sleep. So if you're inside all the time and maybe you have some artificial lighting, then your sleep quality is going to suffer. You need that
Are you
contrast.
referencing me right now with this bad fluorescent light behind me? Because I am in your demographic.
You know, if that fits, then it's a great time to explain. It doesn't actually take that much time outside to make the pendulum sort of swing over to that light availability. So, what I mean is, if you were just to wake up in the morning and spend 10 minutes outdoors, even if it's a cloudy day, the amount of lux or light units getting into your eyes and signaling your brain that it's time to be awake, the amplitude of that signal is really important for then 16 hours later when it's time to fall asleep. Your brain sort of understands that this is the contrast. So the pendulum swings the other way, and now you're going to get to sleep easier and your sleep will be deeper as a result of that contrast.
That's interesting. Okay. And so, I mean, you mentioned about the balance too, the contrast and the balance. What other, I mean, I don't know, these maybe even just personal tips for me of what can I do or what can folks do to prioritize the fall asleep? I hear people have a lot of trouble with that too.
People have so much trouble falling to sleep and then falling back to sleep if there's a nighttime awakening. And a lot of times, when you're lying in bed and it's dark and quiet and you're just there with your thoughts, the curtain is pulled back on your relationship with yourself, right? Because you don't have the distractors that sort of keep you occupied during the day. And this is where the idea of monkey mind comes to play. Like, you're replaying conversations that you wish you would have done better. You're thinking about your to-do list, and, these thoughts are kind of bouncing around and creating feelings like anxiety or overwhelm, stress. Those feelings are completely incompatible with sleep. And it's sort of a flag to reveal areas of your life that need more balance. So if that's something that resonates with you, I would suggest looking earlier in your day. How can you wind down? How can you manage your stress better so that when it's time to sleep, your mind is in a more soothed place? It's more in a place to say, the day is over. There's not anything else I can do to affect my relationships or my job or whatever. It's time to rest. So it's an analogy I like to use is kind of like landing a plane, right? When it's time to land, there's a lot of things that happen between 30,000 feet and the ground. And you kind of have to anticipate that, prepare for it, and make sure that landing is smooth and not sort of bumpy, because you're definitely going to be agitated with that.
I like that. That's a good analogy. Cool. Yeah, thank you. So another thing I hoped we could talk about, and initially what brought us together to talk was that you're using body composition assessment in your practice. And I think that was a totally interesting kind of application for me to understand. So can you tell me a little bit about what you're doing and how you might be using that with your particular clients?
Yeah, I want to be clear that I've tried the body composition analyzer. I haven't incorporated it into my practice yet, but I can definitely see an application there. So one idea is that especially where sleep apnea, obstructive sleep apnea is concerned, there's a higher risk for people who tend to carry their weight around their middle, their abdomen. So the body composition analyzer can look at that and sort of differentiate from somebody who's got more weight around their hips and legs. Now, imagine if you're someone who does have weight in your abdomen and you're lying down, that mass is going to push up more on the diaphragm, which reduces what's called the functional residual capacity. So your lungs are kind of pushed up a little bit. You can't take as deep of breath. And there's a concept of tracheal tug. So if your trachea is not having as much tug or downward movement, then there's more collapsibility that occurs even in the space behind the tongue. So people who carry weight in their abdomen are more at risk for obstructive sleep apnea. But as you lose weight, especially if it's from the abdominal area, then obstructive sleep apnea can get better.
So monitoring kind of that visceral adipose tissue and waist circumference are important parameters.
Yeah, and I think it's a lot more accurate than doing a waist circumference. And even for small changes, that feedback can be really helpful and empowering for somebody
Mhm.
who's just trying to get all their vectors pointed in the direction of health. So having the availability of, a more accurate measurement that can detect small changes is really nice.
I like the way, yeah, I like the way you put that. Well, that's great. So, when we talk about, I just was thinking about your comment about kind of the long-term nature of obesity, the chronicity of it, and sleep too. And so we don't just, lose weight and be all better from all of these other, areas. How do we kind of continue to monitor that for someone who, like you said, they're not snoring, they've lost a little bit of weight, their metrics are looking better, maybe they've lost some of their visceral adiposity. What do they monitor longer term?
Are you for obstructive sleep apnea?
Yeah.
Yeah. So when I see somebody who is losing weight and they have sleep apnea, most of the time it's treated with CPAP therapy or autopap therapy. I look at about the 10% weight loss mark to see, are they having symptoms of sleep apnea at that point? If they are, then treatment should definitely be continued. And sometimes that means coming off of their CPAP machine for a night or two to find out, if they're still snoring, waking up, gasping, and things like that. If there's no symptoms or symptoms have improved significantly, then we can do a home sleep apnea test or an in-lab sleep study to quantify what improvement might be translating to their AHI. And that's at this time the sort of metric for measuring sleep apnea severity.
Okay.
Now, one problem is we all know the limitations of a BMI, the body mass index. It doesn't really give you a great picture of somebody's adipose distribution and a number of other things. The same is true for the apnea hypopnea index. It doesn't tell you how long the airway obstruction is occurring. It doesn't tell you how deep the blood oxygen levels are going. It doesn't tell you a lot of things that would make me bump up the severity category for somebody with sleep apnea. So, recognizing that limitation is important, especially in the context of a home sleep apnea test, which also has some limitations.
Ah, okay. See, there's so many parallels between the two fields.
There really are.
It's really interesting. Another one I thought of, one of the, in my kind of behavioral lens, I'm always trying to get people away from focusing too much on that one number on the scale or on that BMI and try to look at, the bigger picture. And I think I told you this, that I have sort of said, well, we're getting obsessed with numbers. We want to get away from that. If you're going to be obsessed with a number, why don't we focus on sleep? And then we had our conversation. I said, maybe I can't do that either. So, um, but we were talking about those monitors for sleep, and is that something that you recommend for trending? I know it's not a replacement, just sort of like home body composition is not a replacement for in person, on the research grade, clinical grade quality devices. But is there a place for that and looking at your sleep and checking in patterns in yourself?
I typically like it when somebody becomes interested enough in their sleep to monitor it and kind
Yeah.
of check their parameters. There's a lot of different things to look at. And now with the consumer wearable devices like Oura Ring, the Fitbit, and Apple Watch wrist devices and things, there's metrics that people can look at, which is great, but take it with a grain of salt a little bit because the marketing game is quite strong,
Yes, it is.
although the accuracy isn't quite there yet for things like sleep stages. Wearable devices are pretty good actually at determining when you went to sleep and when your final wake up time was. So that gives you an estimation of how much total sleep you got. And over time, people become familiar with this and can also relate it to what they're experiencing during the day. So, for example, I had an early flight a few weeks ago. My Aura Ring detected that I was up earlier than usual, and normally that's 4 a.m. for me. So I was up at 2 a.m. for this early flight. So my sleep time was compressed. And during the day, I was using that information to make choices. For example, when it was 2 o'clock in the afternoon, I was kind of dragging and I thought, oh, maybe I'll get a cup of coffee. But then realizing that I'm probably going to go to bed a little bit earlier than usual, I decided not to because I didn't want to affect the next night of sleep. So instead, I got outside and I took a brisk walk, deep breaths, all of that helped me feel better. So if people can use that information to make different choices during the day, I think that's great. But there's a dark side here, which is the concept of orthosomnia. Have you heard of this?
You told me about it. I think
Oh,
it's
great.
super interesting.
Yeah, so orthosomnia, and there probably should be sort of a parallel in the weight management world. Orthosomnia describes an anxiety or sort of an obsession with your sleep quality or continuity. And it's because we can have these metrics on our wearable devices. So people get a little bit agitated if they feel like they're underperforming. And that all by itself can inhibit sleep because, as you know, sleep is an emotional experience. So if you're anxious about the numbers, it competes with your sleep.
So I feel like I've seen that in folks too, and I mean definitely some relatability to nutrition and eating behaviors and all
Yeah.
of that. Yeah. So I like the way you put that, the dark side of it, because there can be so many good benefits to having more data, but if it's not inspiring behavior change or if it's not helping you to make those little tweaks to your daily regimen, then it's really just more data. And we're already in a world where there's probably too much information coming at us all the time. So,
Totally agree. Yeah.
well, yeah, well, this was a great conversation. I don't know if you have anything else you want to leave us with or how people could get in touch with you if for themselves, for their patients. We have mostly healthcare providers, who are listening.
I would say just email me directly. I'm at Dr. Wells at Supersleep MD. That's DRWELLS at supersleepmd.com.
Well, thank you so much. And hopefully we'll connect at the next obesity medicine meeting, I think
I would
next
love
month.
to see you there. Yeah.
All right. Thank you so much.